Great. Well, we have lots of participants joining us today. So thank you for logging in and being with us in this virtual space to join us for the fourth webinar of our 2024 webinar series, Ageism, the Multigenerational Workplace. We have members who have been with us so many times. I see you're already sharing with us a hello and where you're from in the chat. We really appreciate that. So if you want to just use the chat to tell us where you're from right now, we love seeing all the states pop up. A quick disclaimer that the views and opinions expressed in this program today are those of the speaker solely and do not necessarily reflect the opinions, views, or positions of HealthLinks, our program, the Center for Health, Work, and Environment, or the Colorado School of Public Health. And please engage with this webinar at the level that best suits you. We always start with a land acknowledgement, and I'm going to start that right now. So as we gather in this virtual space, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. Further, we acknowledge the 48 contemporary tribal nations historically tied to the lands that comprise what is now called Colorado. Acknowledging that we live in the homelands of Indigenous peoples recognizes the original stewards of these lands and their legacies. And with this land acknowledgement, we celebrate the many contributions of Native peoples to the fields of medicine, mathematics, government and military service, arts, literature, engineering, and more. We also recognize the sophisticated and intricate knowledge systems Indigenous peoples have developed in relationship to their lands. We recognize and affirm the ties these nations have to their traditional homelands and the many Indigenous people who thrive in this place alive and strong. We also acknowledge the painful history of ill treatment and forced removal that has had a profoundly negative impact on Native nations. We respect the many diverse Indigenous peoples still connected to this land. We honor them and thank the Indigenous ancestors of this place. The University of Colorado pledges to provide educational opportunities for Native students, faculty, and staff, and advance our mission to understand the history and contemporary lives of Native peoples. A little bit about us. My name is David Shapiro. I am a white male in my late 40s. I have dark brown curly hair and gray rimmed glasses. Today I have a clean shaven face as well. Our program is a public health outreach program that's called HealthLinks. And we work with organizations on their commitment and employers of all sizes in every industry on their commitment to worker health, safety, and well-being. Our center, the Center for Health, Work, and Environment, is one of 10 centers of excellence for total worker health funded by the National Institute for Occupational Safety and Health at the CDC. And we are located on the University of Colorado Anschutz Medical Campus in Aurora, Colorado. With that, we want to mention a few housekeeping items today before we start with our presentation. All participants in the webinar are on mute through the duration of the presentation. And we want you to use the chat for any technical assistance you may have. And already seeing everyone on chat chiming in and telling us where you're from, we really appreciate that. So if you have any technological issues or need technical assistance, chat is where to put in those requests. Closed captions are available for those who need them. Use the Zoom function to do that. And we're going to have a question and answer section at the back end of our hour. So if you have specific questions for our panelists and speakers, please use the Q&A box for that so that we can vote on those. And some of our friends and colleagues may have the same question that you have, and it prevents us from having to type it multiple times. We do issue continuing education credits. There will be a survey that hopefully automatically pops up at the end of today's webinar. That will be how those of you that need CEs, continuing education credits, receive those. We'll make sure we put the link to that in the chat as well when we're ready. This webinar is being recorded, and we will share a recording of the webinar in the next 24 to 48 hours as well. The agenda for today, we'll have a keynote presentation, and then we'll have a discussion with a few speakers that help put context around the keynote. And then, as I mentioned, we'll have a question and answer section. So as we're going through the presentation, be thinking about what questions you have and use that Q&A box in your Zoom toolbar for the questions you have for any of the speakers that come up today, or really anything that you think about. Our learning objectives are to understand multi-generational dynamics in the workplace, Also to learn about how to implement workplace health and safety strategies that cater to the diverse needs of different generations in the workplace. And then finally, to strategize and promote a cohesive and productive work environment for all. With that, I'm going to introduce our keynote speaker, Dr. James Grosh. James Grosh is a senior research psychologist and co-manager of NIOSH's Center for Productive Aging and Work. He has a PhD in social organizational psychology and an MBA, both from the University of New Hampshire. His work at NIOSH focuses on better understanding how behavioral and work organization factors affect a worker's safety, health, and well-being. Recent projects include changes in health and cognitive ability that workers experience as they age, characteristics of age-friendly workplaces, job stressors associated with increased risk of heart disease and depression, and the impact of job transitions like retirement and being laid off on both physical and mental health outcomes. In addition to his work at NIOSH, Dr. Grosh served as a visiting scholar at the Liberty Mutual Research Institute for Safety and a summer faculty fellow at the Defense Equal Opportunity Management Institute, Patrick Air Force Base. So, Dr. Grosh, thank you for joining us today. If you can share your screen with your slides, we'd appreciate it.
I have done that. David, does it look okay to you?
Looks great. Thank you, Jim.
Okay, great. Thank you very much, David, and everybody else also who has helped organize this Health Links webinar. I'm really looking forward to it, and I've been following all the people who are coming in from all over the country and maybe overseas as well. And it's wonderful to see so many people out there from different states and backgrounds and organizations. So what we'll be talking about today is, of course, David mentioned it, ageism and the multi-generational workplace. Just so you know something about me and my appearance, I'm a white male. I have a beard and a mustache, graying hair. I would not object if you refer to me as an older worker, because I probably am by most definitions. I've got a light blue plaid shirt on and glasses. Also, I should acknowledge my co-author on this presentation is Gigi Petrie, and she is co-manager of the National Center for Productive Aging. We're, of course, at NIOSH, as David mentioned, CDC. I am currently sitting at home, which is about 20 miles north of Cincinnati, which is where NIOSH, one of the main offices of NIOSH, is located. So just to give you a preview of what I like to cover in the time that I have, we'll get into a little bit of demographics about aging. We'll talk about the concept of productive aging, which is what our center at NIOSH is all about. We'll get into the link between age and also occupational safety and health well-being outcomes. We'll get into ageism, talk about definition, prevalence, and the effects of ageism, and then the issue of a management approach and the idea of designing an age-inclusive workplace. So very quickly, I suspect I don't need to convince anybody out there that our population and our workforce is aging in this country and in many other countries. This is just one illustration of that. This is called the old age dependency ratio. And it's simply the number of people in the population 65 years and older relative to the number of the people in the population who are younger, 15 to 64 years old. And as you can see, it's been fairly stable for a number of decades, going back to the 60s. Currently, we're a little bit obviously beyond 2000, but then it was one older person to every 5 younger people. And as you can see, we're at a point, we're in between 2000, 2040 in that graph, and it's increasing. And it's going to be increasing for a number of decades, probably the rest of our lifetimes, actually, until 2080, when it will be 1 to every 2.5 younger people. And I'd like to put this up just to illustrate that the issue of aging in our society and many other societies is a long-term phenomenon. It's not going to go away when the baby boomers retire or something like that. It will be with us for decades. And this has implications for a lot of different things like Social Security, Medicare, it's hard not to hear that being discussed these days as people talk about the fact that we'll have fewer younger people and more older people that need to be supported in, healthcare, in Social Security, things like that. The next graph is another illustration, and this is just the change in the labor force. And this is the past 20 years, from 2004 to 2024. And this is the percent change in those age groups in terms of labor force. And as you can see, the change is really 55 years and older. The younger age groups, it's a little bit up and down here and there, but not an enormous amount of change. And all the action is really 55 years and older. This is the labor force participation rate, which is another measure of labor force activity. And again, you can see it really increases once people get to 55 and really 65 and 75 years and older. And this is because pension systems are not quite as good, and there's more financial, perhaps incentive, maybe work has gotten less physically demanding. There are a lot of factors as to why labor force participation increases. But again, we're going to have more older individuals, fewer younger people, and probably a need for people to continue working beyond the age which maybe a generation or so ago they might have retired. So with this in mind, our center was established in 2015 at NIOSH. We are part of the Total Worker Health Program at NIOSH. Myself and Dr. Petrie are the co-managers. And these are the kinds of goals that a lot of our centers at NIOSH have. So we want to identify research needs that exist when it comes to a workforce that's aging. We want to expand our knowledge of effective interventions and best practices, and also develop a broad range of useful translational or educational products on the aging workforce. So what is productive aging? That's a place to start. And it really is a reaction against ageism. And this goes back to Robert Butler, who was one of the first people to coin the term ageism back in the 70s. And what he said, and this was an observation he made about what it was like to become old in America. And he observed that in America, childhood is romanticized, youth is idolized, middle age does the work, wields the power, and pays the bill. And old age, it stays empties of purpose, gets little or nothing of what it has already done, the older in the way. And this was a view that was prevalent then. I think it is prevalent now, although perhaps more nuanced and not said quite this way. But he was arguing that we needed to think about this in a much more positive way in terms of aging, and that we had to, because with an aging population, we can't let people just be in the way. We need to be able to utilize their abilities and skills and keep them engaged. And this was his idea of productive aging that has influenced the center that we have at NIOSH. Productive aging is an approach that emphasizes the positive aspects of growing older and how individuals can make important contributions to their own lives, their communities, and organizations and society as a whole. So again, it's a more positive take on aging and emphasizing that we can continue to contribute as we get older and continue to function in an effective way. This is our model of productive aging that we developed for the center. It's a lifespan perspective, so we don't focus on any particular age, like 55 years and older. The fact is, all of us are aging, and there are different safety and health risks throughout the lifespan or the work span in the workplace. It's a comprehensive and integrated view of occupational safety and health, very much like Total Worker Health, has that kind of multi-level view of what we can do in the workplace, and outcomes that focus on both employer needs and worker needs as well. So a worker, as they get older, may want to have work that's safe, that's engaging, that's flexible. An employer, on the other hand, might want to reduce healthcare costs, might want to transfer knowledge from one generation to the other, something like that. And what we argue is that both perspectives have to be taken into account. And finally, this idea of a supportive work culture for multi-generational issues. We know we have different age groups out there, and that there can be a lot of differences when it comes to things like the use of technology, how people want to communicate with each other, how they work in groups, how they resolve conflicts. And the workplace needs to accommodate all the differences that we find across different age groups. So one thing I just wanted to summarize for you is the science, what we know about the link between age and occupational safety, health, and well-being. I'm going to try and do this quickly. This is a table I'm going to fill in for you quickly, and it's going to summarize the literature that we have out there. And some things we know get worse with age in the workplace, some things get better, some things tend not to change at all. And these are the ones that research tells us do not change very much. Things like core job performance. If you want to predict somebody's job performance, there are many things much better than age. Their training, their motivation, things like that. Age really isn't a good predictor unless maybe you're talking about something very physically demanding, and then it may have value. But in many cases, it doesn't tell you that much. Absenteeism is the same way, ability to learn from training, creativity. The one at the bottom there has an asterisk, and that's because the answer is it really depends. If you do a survey of back pain in the workplace, you'll find that it's around 30% for most age groups. However, if you look at those people who have a physically demanding job, like they do heavy lifting, for instance, and they continue to do that as they get older, then there is a risk factor of age because of the exposure in the workplace. So in that case, it's not just age, it's what you're doing in the workplace that combine together. These are some of the things that we know get worse with age: fatal or severe workplace injuries, slips, trips, and falls, return to work following an injury, illness takes longer, chronic health conditions, arthritis, diabetes, COVID-19 would be another example, and skills obsolescence. But we should never forget the things that get better. Overall rate of non-fatal workplace injury goes down. And that's even though slips, trips, and falls, as was mentioned, goes up. Life and job satisfaction get better. Counterproductive workplace behaviors tend to go down. Presenteeism, which is coming to work and you're not feeling that well and you're not that productive, that tends to go down with age. So people, as they get older, are better able to deal and to remain productive in the workplace. And then one that we probably all know about is that diversity of knowledge and experience tend to get better with age. And I wanted to present this just to give you a sense of the complexity here. You know, when we talk about stereotypes of aging, we often think in very simple terms. And the reality, the science, is much more complex. And some things, again, get better, some things get worse, than some things there is no link with age. And this is often referred to, we get rid of the things in the middle, it's referred to as the paradox of aging. That again, some things worsen, but some things get better. So what are the implications of this? Impact of aging is gradual and complex. Workplace exposure matters. So it's not just age, it's what you're doing, it's what's going on around you that also matters. With aging, it's often said that primary prevention is paramount, because if an injury or health condition does occur, it's more likely to be severe. So we try to prevent it. Those are the things of concern. Most of these I think I mentioned, of promise, those I mentioned too. And all of this results in this idea that we need an expanded way of how we think about safety, health, and well-being in the workplace, which is what a total worker health perspective is all about. So let's get to ageism for a second. Ageism refers to the stereotypes, how we think, prejudice, how we feel, and discrimination, how we act towards others based on their age. And this is a model that's often used to kind of diagram that. We have cognitive or thoughts that lead to stereotypes that can influence our feelings about people and our behavioral, our actions, and result in discrimination. So it's, you know, how we think, how we feel about things regarding age, and how we act. And that's, they all intersect and affect each other. People often also talk about explicit bias and discrimination. This is where we are aware of it. There's been a lot of interest recently in implicit bias and discrimination. These are unconscious attitudes that we may not always be aware of, and these lead to discrimination. And people sometimes distinguish between hard and soft. Hard would be actions that are illegal, not hiring somebody because of their age or not giving them a promotion opportunity simply because of how old they are or young they are in some cases. But there's also soft discrimination, which tends to be more common. And this is where somebody might make a remark about somebody or leave somebody out of discussion just because of their age. So it can be both hard or soft and explicit and implicit. So we're going to do a poll just to see with all the variety of people we have out there, uh, have you ever experienced or seen discrimination in your workplace? And it's yes or no is the two answers. And in a second, we'll compare this to what surveys have found. At some point, we can see maybe a summary of the answers. Okay, so there we go. 72% say yes, and 28% say no. And that is very interesting because, as you'll see, I think it is pretty consistent with some of the data that we have. So I guess we can close that. There we go. And let me just show you what various surveys have found. And let me see if I can advance this. There we go. So AARP does a survey of people 50 years and older. And the most recent results were 2023. About 2/3, 64%, said yes to that particular type of question of seeing it or experiencing it. But keep in mind the sample. These are people 50 years and older. We had, I think it was 72%, so it's similar to that. This is a survey of human resource professionals done by the Society of Human Resource Management. They reported 32% said it played a role in the application process, which is just one aspect of, obviously what goes on in the organization. 17% they have said they have received reports of perceived ageism in their workplace. And so, those are formal complaints. That would be hard discrimination if you wanted to think of it that way. And NIOSH has its own quality of work life survey that we do every 4 years or so. And in 2018, it was about 8%, 7.9% reported that they had experienced themselves age discrimination. So it really depends how you ask the question, whether you've seen it or you've experienced it yourself, or in your capacity, let's say, as HR or manager of a company. So the answers can vary a little bit. It also depends on the worker. And this is one thing we found and other people have reported. This is the NIOSH Quality of Work-Life Survey. Again, this is a national representative sample of workers. And when we ask this question, do you feel in any way discriminated against on your job because of your age? You can see you get a U-shaped function where it's high for the oldest group, 65 years and older, but it's even higher for younger workers. So age discrimination is not just limited to people who are older. It can exist for other age groups, especially younger people as well. Some of the most commonly reported types of age discrimination. These are the ones that get mentioned the most, and this comes from that AARP survey. So it's got to remember these are people 50 years and older. The most common one are negative comments, which is probably a soft type of discrimination, followed by job application information being requested about age, and you can see the other ones, comments about your age at work as opposed to a coworker, which was that first one, not being hired because of your age is next. And you can see the percentages there. So there's a variety of ways to look at this and think about it in terms of the percentages. But I think the percentage we got of 72% is very consistent with what AARP has reported in terms of that idea of either experiencing it or seeing it. Okay, impact of workplace ageism. These are, there's a lot of research saying that it can be linked to poor health, reduce occupational self-efficacy, work engagement, things like that at the worker level. It can also be looked at the organizational level in terms of EEOC complaints and claims, things like that. And even more importantly, missed opportunities, because people feel they're being left out, they're being treated unfairly, and that can result in decreased productivity, among other things. And society, the U.S. economy has been estimated that this idea of missed opportunities, there's a cost to that, a big cost, $850 billion, and healthcare costs are also impacted by that. So we can talk about, and you'll hear this, I think, from the other speakers we have today about different ways of combating ageism. And you can take a lifespan perspective. I think this is a good way to look at things in terms of the needs and motives that people have at work that change over time. And it's not just age, it's also life circumstances and career stage. Things like explicitly including age in diversity, equity, and inclusion initiatives. Sometimes age gets left out. We can talk about age, HR practices, where we look at people irrespective of age, and we try to foster knowledge, skills, abilities, motivation, effort, et cetera, opportunities to contribute, and make sure those opportunities are there for everybody. And what I want to spend the rest of the time I have on, and I know I'm getting close to the end here, is how we might be able to promote a age-inclusive workplace. So one model that we've used in thinking about what it means to have an age-inclusive workplace, which again is kind of the flip side of ageism. We want to do things that bring out people's ability to be productive as they get older. This model is a very simple one. It's called workability model. And it says we need to focus on three areas. One is the work environment. These are traditional areas of safety and health. The organization of work, which is how work is structured. Things like flexibility, leadership, work-family programs and conflict, as well as the individual worker. So these are the three different kind of levels. This is kind of a total worker health perspective. Again, we're doing kind of a holistic kind of approach. Let me give you some examples of each one of these. This is work environment. You can see things like lighting, noise, workstation design, conditions that may lead to falls, repetitive motion tasks. We can also look at things for the individual worker, worker-related skills, return to work programs, health screening, health promotion. Things like lifelong learning, career development are important. And finally, organization of work, workplace flexibility. Providing that for people throughout their working lives is important, and perhaps even more important for older workers. Shift work and overtime, age diverse teams, job redesign, et cetera. So all of these areas are ideas or strategies that can be taken. One of the things we do in some of the training we do is to have people work in a planning matrix like this, where we take each of those three areas and we go through the details of the specific goal they would have, action items, who would ensure that it happens, et cetera, when it will finish, and challenge responses to those challenges that you might have. Here's just one example for the work environment, is to reduce knee strain among employees working in stockroom, action steps, installation of wooden flooring. And you can see some of the things that are also included there, looking at costs and trying to think about how it would be implemented. And this is the kind of thing in the workshops we do. It takes a lot of time. It can take several hours to work through it. Usually it takes more than one session, but it gets you into the details of it. And the idea is to do it across all three levels if you can. So just some practical considerations in implementing these sorts of things. There's an issue of choosing goals that are large enough to make an impact, but manageable enough to be accomplished. Needs usually go beyond just education or training. Many small changes can have a big impact. It can be challenging to do this in all three levels, but the idea of planning teams and getting people to work together to represent different areas in the organization. So just a few quick ending points. The US workforce is aging, will do so for the foreseeable future. Age has a complex relationship with occupational safety and health outcomes, and this runs counter to the idea of simple age-based stereotypes. Age discrimination is widely reported at work and has adverse effects on health, productivity, engagement. Models like the workability model that I went through very quickly can help identify some of those strategies. And many of these practices or interventions that target older workers have benefits for all workers, regardless of age. I had that quote at the beginning that from Robert Butler, his observation that was about ageism. I thought I'd end with something rather positive that really reflects more productive aging. Growing older is like climbing a mountain. The higher you get, the more strength you need, but the further you see. So with that, as a final observation, thank you very much for your attention. I've gone over a little bit, so let me turn it back to David quickly.
Thank you so much, Dr. Grosch, and thank you for those individuals that are engaging with the Q&A section of our webinar format today. We have with us as well Dr. Grosch's co-author, Dr. Petrie. Gigi is in the Q&A and answering questions for everyone, so thank you, Gigi, so much for doing that. I'm going to introduce our next speaker on our panel here. That is Dr. Katia Costa-Black. Dr. Costa-Black is the Senior Manager for Education and Partnerships at the Oregon Institute of Occupational Health and Sciences and the Outreach Core Lead at the Oregon Healthy Workforce Center at the Oregon Health and Science University. In these roles, she oversees the total worker health education and training portfolio of the Institute and is tasked with building strategic partnerships with practice and academic communities in the Pacific Northwest region. Dr. Costa-Black holds a BSc in physical therapy, an MSc in ergonomics and biomechanics, and a PhD industrial engineering with an ergonomics focus. Her research and teaching activities are focused on system-level preventive strategies and applied program implementation methods. And prior to joining the Institute, Katia served as a consultant and scientific advisor to a number of organizations and provided occupational safety and health services to several major corporations in the US and abroad. So thank you, Dr. Costa-Black, for joining us as well today. I have your slide up here, and tell us more about ergonomics and older workers and the work that you've done here.
Thank you so much, David, and thank you for the introduction and the invitation. I'm very excited to be part of this panel and bringing my practical views on this much needed conversation about how employers can prepare and deal with the aging workforce reality and the talent retention, as mentioned by Dr. Grosch. And for the sake of this audience, I am middle-aged, light-skinned Latina woman with dark brown hair, glasses, and wearing a black and green outfit. And as proposed by Dr. Grosch, and the presentation was really going well and fitting well with what I have to present it here. And I want to mention there's a lot to be done at the level of the work environment, and that's going to be my focus descriptions right now. Unfortunately, what we know is that many employers, and in the practical world, I've seen this in my experience as a consultant, that many employers are actually missing to consider those interventions that support age-inclusive workplace. And they might be thinking that maybe it's going to benefit only a few workers, or they think that it might be too costly. And in this kind of very short time that I have now, I'm going to highlight the contributions of human factors and ergonomics for age-inclusive workplace, and trying to make sense of what is available out there in terms of those work design interventions in this area. And before I specifically describe these interventions, I want to share with you this proposed roadmap that is shown in this slide as part of this global project called the Maya Rise Project. And what you see here is the 6 domains identified by comparing best practices and policies developed in 8 countries: Canada, France, Germany, Italy, Japan, New Zealand, Slovenia, and United States. And I won't be able to describe all these domains here, but what is interesting to notice about this project is that they have identified many organizations across the globe that are doing tremendous work to support more age-inclusive workplace by targeting all these domains. And even if some organizations target only a few of these domains, they are very interrelated and they overlap. And the findings of this project also show how this pathway to age-inclusive workplace is deeply connected to national policies in the countries that were studied. And it was also interesting to me to read that there are countries-specific differences that we really need to recognize how they are advancing in that recognition of the need to move forward with this pathway to age-inclusive workplace. If we take a system approach to understand the available best practice for age-inclusive workplace, this particular roadmap brings all these policy and practices together across this spectrum of all interventions mentioned earlier by Dr. Grosch as related to the work environment, the organization, and the individual. And we know well that only equipping workers with the right equipment and ergonomic workstation is definitely not enough. And with this mindset, it's important to acknowledge the available work design guidelines that we can rely on in terms of enhancing the human experience at work. And these are the inclusive design, the universal design, and prevention through design principles. And they all intersect with human factors ergonomics principles that I will be discussing a little bit more in a minute. And for those of you who are not familiar, just to really, in a very nutshell, inclusive design aims to create environments, policies, and tools that accommodate employees of all ages, including equal participation and productive regardless of age. Universal design for age-inclusive workplace focus on creating environments that accommodate employees of all age, from younger to older workers, and ensuring equal access, participation, and productivity. Prevention through design focus on designing workplaces and processes that proactively consider the safety, health, and abilities of workers across all ages. And you can see the commonalities between the principles if you go deep into it. So if you move to the next slide, David. Thank you. So as workers get older, we know that a loss in cognitive functional capacities may take many of the tasks that they perform efficiently, they might become harder to perform. And the decline in physical capabilities among aging workers, particularly in physically demanding industry, combined with exposure to occupational risks, often lead to significant challenges for employers to deal with early retirement and leading to early retirement and workforce losses. And there are also age-related changes in the locomotor system that can increase the risk of musculoskeletal disorder, particularly in manual and high physical demanding types of tasks, including manufacturing industries mainly. And these physical and mental changes can significantly affect the balance between job requirements and individual job capacity, specifically when the task is highly physical, demanding, and poorly designed. But research shows that there is great variety among older workers with regards to those physical, sensory, and cognitive functions. And we also know that there are many opportunities in the work design to address this change in a way that all workers can benefit. And essentially, industries must develop a specific work design strategies to support older workers to remain as long as possible at the workplace and prioritizing their safety and well-being. So when it comes to addressing these physical changes, we know that the physical ergonomics realm has a number of interventions and solutions that are being tested over time and showing effectiveness. And we know ensuring workstations that are designed to reduce physical strain with adjustable chairs, proper lighting, use of sit-to-stand desks can benefit all workers because it promotes movement, a proper body posture, improves blood circulation, reduces fatigue. And depending on the postural changes and body aches and pains, adjustments is really important in the workstations. And it should be tailored to different individuals. And training and education goes hand in hand with this type of solution. I also want to mention the idea around using anti-fatigue mats for work that are predominantly standing. And this will also, again, benefit all workers and looking too closely into proper scheduled breaks for muscle recovery, as well as paying attention to reducing repetitive strain, as mentioned by Dr. Krosh, in a way that is protective of the wrists and fingers in particular. In terms of addressing sensory and cognitive changes, there are many cognitive ergonomics interventions that are available. I'm going to just list a few and increasing a few of them that are being well known, and I had experience to test this in different types of environment. Increasing sight of printing when we're talking about signage and pictures. Improved lighting is a very important one. Increasing contrast and trying to really create more contrast that allows the use of color to differentiate between tasks and especially for cognitive demanding tasks. Prevent glare on floors and that radiates from the floor. Reduce noise to boost the focus and auditory distractions. Use friendly technology, including voice activation tools and speech recognition software. There are many others. I won't go into much details now. And I think the last, and I will take the questions and trying to go deep into some of these other strategies, especially for the cognitive and sensory changes that I find is very important. But another important human factor and ergonomic solutions that go hand in hand with the cognitive and physical ergonomic solution is the workplace flexibility policies. And we know that these policies are really important in terms of giving flexibility for working hours, for workers that needs to be in a part-time situation, arrangement, in terms of job sharing responsibilities, and in terms of remote work as well. I think I want to finish here, and I want to really go deep into some of these examples if questions come up. But this is kind of my overview and trying to really get to some of the examples that are relevant for considerations in the design, in work design.
Thank you so much, Dr. Costa Black, for providing the ergonomic aspects of supporting older workers. And I love that so many of these solutions that are being suggested, both by Dr. Grosh and now you, Dr. Costa Black, are really relevant for all workers and also of specific benefit to aging workers as well. With that, I'm going to introduce our third speaker of the day, which is Sean Morris. In addition to being a licensed clinician for over 20 years, Sean holds credentials as a substance abuse professional and certified employee assistance professional. An active participant in his community, Sean serves as a board and committee member on several state associations, including the Utah Critical Incident Stress Management Program, the Utah State Bar Lawyers Helping Lawyers Board, and the Wellbeing Committee for the Legal Profession. Sean is a married father of 4 children, and outside of his professional endeavors, he enjoys running, road cycling, mountain biking, playing racquetball, skiing, and being outdoors. In the past, Sean's worked as a firefighter, emergency medical technician, and a ski patroller. So thank you, Sean, for joining us here as well and for providing additional context on the work you've done with employers, consulting on some of this work.
Thank you, David. And yeah, it's great to be here with you. Thanks, Dr. Costa Black and Dr. Grosh, for your great presentations and information as well. And as David kind of shared all the things that I enjoy, running, biking, hiking, all those sort of things. They get a little more difficult as I get a little older. So I'm in my early 50s now, and I've had the privilege of working for several years with organizations on this topic of how to navigate just the different aspects of these different generations in the workforce. And certainly there's some great things that can happen with the diversity, but there's also some fun and kind of interesting things about it. So just kind of some creative, for some interest's sake, of things that you may already know, but maybe not. So depending on where you're at here, the silent generation, those are people born in the 1925 to 1945. Baby boomers, 1946 to 1964. Generation X, that's the generation I'm a part of, 1965 to 1980. Millennials, 1981 to 1996. Generation Z, 1997 to 2010. And the newest generation, which is currently being called Generation Alpha. So most of them are young. They aren't into the workforce yet. But the other interesting thing is kind of how we refer to each of those generations. You know, the silent generation has been known as people that are extremely loyal. The baby boomers were optimistic. There was a lot of opportunity for them, but also quite competitive in what those opportunities were. Generation X, again, the part of the generation I'm a part of, were known as skeptical. Every institution and individual we can mark, and that they were kind of called into question during the time that we were growing up, and certainly gave us different views on how to perceive people and organizations. Millennials, realistic, but also we refer to them as the trophy kids. You know, those were the kids that got a trophy just for participation, where some of us older generations, you know, you had to be in the top to be able to receive the recognition. And then Generation Z, pragmatic, or the I generation, which sometimes is referred a little bit to exactly that, the me generation, the I generation. So, you know, as we look at all of this, and of course, Dr. Grosch said this in his message, you know, it's not just about workers getting older. We can certainly have different dynamics of how we view ageism throughout the lifespan and throughout the age of employees within our organizations. As mentioned, I'm a mental health clinician, and certainly I have found that even for myself, the older I get, the better I become in this role. And I could certainly see some ageism on the other side, somebody who maybe is new in the career, maybe in their early 20s, haven't had a lot of life experience yet, and kind of, you know, questioning a little bit what completely they bring into the ability to do this type of a role. Where in comparison, somebody who might be in construction or something, you might think very differently that, okay, that person is now in their 50s or 60s. Can they really do the work that a 20-year-old or 30-year-old would be capable of doing? So some interesting things that certainly, you know, give us a lot of opportunity to think about how we're approaching things, and particularly how we're approaching things as leaders. As a leader ourselves, or as a leadership team, how do we look at how we are navigating these different generations in our workforce? Are we doing things and finding ways to be inclusive of everyone and getting opinions so that we really can create the most ideal environment that can be enjoyed and appreciated, and adding value from all of our employees? And are we looking at those types of things as we're making different decisions as an organization? Are we also looking at those things on how we recognize employees? Different generations sometimes appreciate, and I guess, of course, this is generally speaking as well, but may like different ways of receiving recognition or appreciation that might be different than how somebody of other generations might. And so there's a lot of things that we need to kind of take into consideration to be ultimately as effective and helpful as we can be with the different generations, and be able to accomplish the goals that we have as an organization. So, and David, I'll turn it back to you. I know our time is a little short here.
Thank you, Sean. I appreciate it. I'm going to ask all of our speakers to rejoin us, if possible, in the in the Zoom space here for the next 8 or 10 minutes on question and answer. And once again, thank you so much to Dr. Petrie, who's responding with so much information and evidence and science on the Q&A. There are two questions right now in the Q&A that I think are really important and relevant, one of which just got answered. But I do want to ask, maybe I'll start with you, Dr. Grosch, about, in diversity, equity, and inclusion work, we talk a lot about intersectionality. Holding multiple minoritized backgrounds, multiple backgrounds that are less privileged or have less power can be, a compounding factor. So the question here was, do we know much about ageism being higher in specific racial and ethnic groups, maybe more minoritized individuals? And I don't know, Dr. Grosch, if you or if Dr. Petrie would be most suited to answer that question, but I think it's an important one, and it connects to the health equity work that we're doing overall at our center. So thoughts there on intersectionality with other identities?
I think that's a really good question. And Gigi, would you like to take this? Because I know
Sure.
you have some views on this.
And maybe just introduce yourself briefly to our audience, Dr. Petrie, because we didn't have a chance to introduce you.
Sure. Hi, everybody. My name is Gigi Petrie. I am an organizational psychologist with a background in occupational health psychology, and my area of interest and specialization is around workforce aging, and in particular around ageism in the workplace. So yes, this is a great question, and it's one that I did try to answer this in the questions that were posted online. And I recently I'm working on a manuscript that's about ready to submit for a publication that's looking at this intersectionality with a variety of different social identities. So I looked at a range of 7 different types of sociodemographic variables, including gender, race, ethnicity, education, socioeconomic status. Do you live in a rural place, an urban place? These types of questions to see, is there something about these different identities? I also looked at employment social identities. So like, what kind of occupation are you in? What kind of industry are you in? What do you work shift work? Do you get paid hourly or salaried? So all these different things that we can grasp onto as a social identity that we have. And when it comes to the sociodemographics, we really didn't find anything, which was shocking to me, because there's a lot of people that do think, and there other studies have found some evidence of that, but we were looking at a nationally representative sample with that QWL data from the General Social Survey. And so looking at it where we're pooling people from all different parts of the country, all different occupations, we did not see that. We did see a few things for employment identities, which was interesting. But I think it's an area that's really ripe for more research. But I was surprised by those results.
Thank you so much. And also, Gigi, I don't know if it was only on my end, but your audio was breaking up a little bit while you're speaking. You may want to consider just turning your video off to maximize your audio capability. Another question came up here that I'll direct to you, Dr. Costa Black, and that's about this idea of emotional intelligence being on your list of OC health measures, that being of interest to the industrial occupational psychologists that are on the list. The specific question is about, is there a specific measurement or assessment that you're looking at? But I just was hoping you could speak briefly about emotional intelligence as part of the list of things we should be considering when we're talking about supporting a variety of generations in the workplace.
Yeah, no, this is great. I think I would say I'm no expert on this particular subject. In cognitive ergonomics, we do cover quite a bit of methodology that are looking closely into all these cognitive functions and domains to address them in the most holistic way possible. Understanding that emotional intelligence has its own kind of individual tailored information that is needed to be considered as part of the growth and recognition of employees in the workplace. employers themselves don't really get a hold of understanding what this is going and what these really entail in terms of supporting workers to motivate. But I think the idea around recognition in words and motivation around keeping employees that are older in the workplace comes to that idea. And that seniority leads to recognitions and also support that they need to retain this older worker in the workforce. I think that there are a lot of information out there on this issue. What I think it's missing is from the practical side to really inform employers how to use that information in a way that supports really the retention of seniority and the retention of the skills developed around that. And we know that recognition of the emotional intelligence, according to some measurements that our occupational health psychologists are really expert on doing that, which is not my background. It's something that is out there, and some companies can use and misuse that information. And I think it's important to recognize that a holistic approach from the human factor ergonomics perspective requires that understanding that we're trying to use and understand the human experience in the work and not necessarily thinking and focus on just one side of the coin, which is the organizational performance, and looking into the human needs and performance needs. So I think we just have to be a little bit careful about a lot of metrics that are out there on that domain and avoiding overlooking at some aspects that might create a little bit more tension between multiple generations coming to the workplace.
Thank you, Dr. Costa Black. We never have enough time for all the questions. There is one more that I want to mention, though, and I think I'll ask you, Dr. Grosch, because we've had a conversation about this in the past. I do want to mention also that we will have a link for your continuing education credits coming up in the chat if it's not there already. But Dr. Grosch, this idea that we're labeling different generations. I know that NIOSH and the Center for Productive Aging has talked more about the multi-generational workplace. The fact is, we are using these terms in modern literature. People are referring to these different generations by word. Are there some, either pros or cons of using these different categories that you've seen? It is pervasive in the literature, and yet we know we're trying not to label people. So I know we just have a few minutes, and it's a big topic and a big question, but do you have any thoughts on, the labels of the different generations versus ageism or some of these other things?
Well, that is a very good question, one that's difficult to address, I think, briefly, but
Yeah.
certainly there is a heuristic value, I think, in talking about different generations. There has been some debate as to whether or not generations exist in the way we often assume they do. It's often thought that a generation experiences the same historical events and that shapes certain attitudes and beliefs. There's some debate about that. And people use generational labels, I think, different ways. Sometimes it's just to refer to an age group. We talk about baby boomers. Well, those tend to be right now older workers. Gen X tends to be maybe middle-aged. Gen Z is younger workers. So it can be used different ways. I do think you can have these stereotypes where we assume that everybody in that group is the same. And that is a mistake. I think there are variations, as there are in any demographic group. And I think, the age label maybe helps us a little bit, but I do think it's not as simple sometimes. It's just assuming that everybody who's a baby boomer, Gen X, or millennial is the same. And we may lose something in that because we lose some of the variability and assume that there's more homogeneity than there really is. So I think those terms are with us. It's hard to escape them in terms
Thank you
of
for that. Really appreciate that perspective. This series continues. I want to thank Dr. Grosch today. It's been a really robust discussion, a really great dialogue in Q&A and through chat. It's always so terrific to see so many people from all around the world joining us. And please stay tuned for our next webinar. You'll get an invite on November 20th. We'll be talking about food at work, a total worker health approach to healthy eating. Thank you again for joining us. Complete the feedback survey that pops up in your inbox. Stay tuned for the follow-up email that includes a recording of today's event. And if you want any additional information about our public health outreach program, Health Links, you'll get links to those as well. So thanks again to our speakers and to our audience for joining us today. We appreciate the discussion and this idea of there being younger aged, middle aged, and older age workers in the workplace, and how we're going to support all workers is really important as we continue our total worker health approach moving forward. So thanks again for joining us. Have a great rest of your day.